everyone. Welcome to If These Lips Could Talk. I'm Dr. Agarwal.
Dr. Wendy McDonald, also known as Dr. Every Woman.
Yes, follow her on the sites and the blogs. We have a blog for women's health called Gynecologist.
It's on the internet.
It's on the WW. We're pretty excited about it, just to help answer some common questions and go over some common topics for things that women usually ask us about when we're in the office. We just wanted to bring that education to people, and so look it up, see if it is helpful. We love when people write us comments or ask us questions about things that they would love to hear either us write or talk about, so make sure that you do that. Dr. McDonald, what should we cover today?
So today we're going to talk about what to expect in a typical gynecologic visit.
Sure. Okay.
Some of you may usually just go to see your internal medicine doctor, your family doctor, maybe have never seen a gynecologist, or maybe you have your daughter or niece or somebody who needs to go see a gynecologist for the first time. This is what you're going to expect.
So there's a couple of different ways that the visit is run depending on your age, but let's talk about a general kind of 21 to 50-year-old woman who's coming in for just a routine visit. When you first walk in the door, of course, there's the receptionist. You give them your name, your insurance information. They check you in. In general, you're going to have to wait for a couple of minutes. We try to run on time. Things happen. So bring a book, something fun to do, because you might be there for a little bit.
Just to address that, we do usually have a very set schedule. You know, we see patients every, say, 20 minutes, give or take. Some ladies are very straightforward. Come in, see them, everything's fine, all is well, move on. You might see that patient in 10 minutes or less. You have another lady who might come in and have a multitude of issues to deal with.
Right.
It's hard to predict that ahead of time, and you may have a smattering of both throughout the day.
Sure.
So that's often why we run behind if we run behind. It's not because we're trying to overbook our schedule or because we're like, you know,
running late. We're sitting in the doctor's lounge drinking coffee.
Eating crumpets. I don't even know what a crumpet is.
It's a London cake.
There
it's
you
delicious.
go. Or there you go. That's right. I've never had one, apparently.
Next time.
But it's not that. You know, we care about your time, we care about hours, but it is sometimes just a timing thing.
Right. We can't.
That you can't predict.
You can't always predict it. Even, I mean, there have been some situations where a woman comes in for just a routine OB visit, and they're 10 weeks, and all of a sudden you're diagnosing them with a miscarriage. That obviously takes a little bit longer time. Or
routine gynae visit, and now they have a big fibroid or a big mass in their abdomen, and then you have to deal with that.
Right, sure. So if we're running late, we try to be very conscious of that. We try really hard to, schedule ourselves so that we can have those plus or minuses throughout the day to keep us in check. But I always just like to mention, we run late, it happens.
We care about you
and
your time, and we're going to give each person their time.
Right, exactly.
If you need extra time, we're going to be there for you, just like we were there for Susie May.
Susie May, who had a big fibroid that we had to talk about.
And I don't know Susie May, so that was not Susie May HIPAA. Susie.
Susie.
I don't know you.
Susie, if you exist, and if your last name is May,
and you have fibroids,
you haven't seen either one of us, so we're sorry.
It was a bad example.
So now Susie May has sat in the waiting room for 20 to 25 minutes. Now the MA, the nurse or the nursing assistant, is going to call her into the kind of the back area to get a blood pressure and a weight and just kind of go over her medical history. Usually this is done in a little private area where you're just going over medical history and do you have any problems or concerns or issues. That part of the visit usually takes about 5 or 6 minutes, I would say, just to review everything. This is a good time to let the I call that the first set of people that you chat with. It's a good time to let them know if you do have any additional concerns besides just your routine gynae visit. So when I walk in the room, I'm not blindsided by all of a sudden, some more things that we want to talk about. It helps us guide the visit if you've already spoke to the nursing assistant or nurse about it already.
And you don't have to tell the front desk person when you walk in, girl, I am here for my vagina. You don't have to tell them
That's not what I mean.
But the private person in the back, that's who you disclose.
Right.
And I also want to point out, the vitals that we get are not just, you mentioned the blood pressure and the weight. People sometimes get a little, uncomfortable or self-conscious with getting their weight taken. And that is still a vital sign for us.
Right. It's pretty important.
It's very important. It's important with regards to, your blood pressure or your overall health, maybe even pregnancy or your issues with, if there's any relationship with your birth control. There's a lot of things we get from your weight and how it's changed from year to year. It's not about shaming anybody or being, talking about things that, we want to make you uncomfortable. It's just another vital sign that is kind of important for us.
It's pretty important. It is very closely tied to the gynae system. That's a good point. Yeah. So after the MA sees you, then usually she'll put you in the exam room. She'll give you, if you come to my office, and they're very expensive couture gowns. No, I'm just kidding. It's like cheap paper. But you're given a gown and a little drape sheet, and you're just kind of hanging out there for a few minutes waiting for the doc to walk in. Excuse me. Do you want to talk about what happens once the doctor comes in?
I am the queen of the sidebar, apparently, with this one. I wanted to mention that the reason that we like the paper is because it's disposable. Now, it's not great for the environment, and I do care about the environment, so just for to know that. But, we don't have, cloth because there's a lot that goes into laundering that and making sure that it's, clean enough from person to person. So there is a fair amount of just making sure that you have something that's fresh and no one else has used it. And disposable to have paper, because people are like, oh, I don't have paper. It's better in an office setting. In the hospital, you can have the beautiful cloth gowns. They have a very sophisticated laundering system that's going to keep it clean and not, spreading disease and sterile disease. I mean, sterile, not spreading disease. But in the office, a lot of times we just aren't equipped for laundering.
So it's all
cloth.
just paper.
It's all paper.
Yeah.
But don't worry, if it tears a little bit, it's paper. It's fine.
So exactly. So usually when the physician walks in, and they're going to just go over your general medical history, see if you have any concerns, and then comes the fun part that everybody gets a little bit nervous about, the exam. So this is a really good time to let your physician know, hey, these have been traditionally painful for me. Can you use a smaller speculum? Dr. McDonald wrote a post about speculum sizes. That's a really great piece of information. There are different sizes depending on your anatomy or what point of life you're in, if you're pregnant, if you're menopausal. So that can really eliminate some of the pain and discomfort that goes along with the exam, just if we're using the appropriate size tool.
Absolutely. And part of the exam, I always tell people I'm going to do a breast exam. I may check out your thyroid depending on what your neck looks like. Sometimes I might routinely, but depending on your doctor, they may or may not routinely check the neck. But sometimes if I see it looks kind of enlarged, I will do.
Symptoms that you've talked about.
There you go. Yeah. And then I'll do a breast exam. I press on the belly, see if I feel any masses in the belly, and then we do that, vaginal exam with the speculum, which is the little duck lip thing, that it can be customized from person to person.
And what's important, this is actually really important. In recent years, studies have shown that we don't have to do pap smears every year. Now, putting a speculum and looking is not the same thing as a pap smear. Putting the speculum inside is just the examination. I'm just looking to make sure the tissue looks healthy. There's no infection or irritation present. The cervix is healthy. There's no polyps or abnormalities. Getting a speculum placed in the vagina is not the same thing as a pap smear, just to be clear.
Though you need a speculum to do a pap smear.
Correct.
But the pap smear is a specific test that checks for cervical cancer screening. And there's swabs that can be done for sexually transmitted infections and various things that are not the pap. So it's always good for you to know, too, what are we doing today, or asking, or we can talk about what you would like to have done in this particular day. But just, as Dr. Agarwal said, just because you're getting a speculum exam is not necessarily a pap or cervical cancer screening.
Exactly. Then usually we'll ask, do you have any questions? Do you have any concerns? Anything we didn't go over? Then usually if you need any medication, so birth control, if you're having an infection, anything like that, then we'll usually prescribe those for you. And that's it. The time that it took us to talk about it is actually significantly longer than the time that you actually are going to be sitting there in a vulnerable position. It's super, super quick, usually super easy.
That's right. And you should always, like Dr. Agarwal said, I can't stress it enough, let us know if it's been uncomfortable in the past, so that we can be prepared for making sure that this is comfortable for you going forward as possible. We don't want you to dread our visits.
Right.
But I wrote a post a long time ago that you probably never seen because no one's seen it. It's fine. About the fact that we are a lot like dentists. The reason I say that gynecologists are like dentists, if you don't go, you could get yourself into trouble.
It's a big deal.
You may not like it. I don't love my dentist visits.
Right. I love my dentist. He's my dad.
Oh, that's sweet. I can handle. We can get through this thing, but it's really important to do it anyway.
Right.
To keep yourself safe.
You want to stay safe and healthy. Absolutely. So what we talked about today was kind of a general exam, 21 to about probably 55, 60. Outskirts of age can be a little bit different. I don't routinely examine under 21-year-olds unless they're having some issues or some problems. But again, that's physician and situation dependent. Above 65, we usually do an exam, don't usually have to do a PAP. And again, that can be catered to each individual woman.
I have ladies who come at 80 who are like, we're still doing this. I'm like, yes, ma'am.
Yeah.
We're still doing this.
It's still important to look.
We're going to keep checking you out.
Right.
For as long as you with us. I don't say it like that. I'm saying it like with that with y'all, you know, but to my older ladies, I'm like, yes, ma'am. Matter of fact, I call them ma'am. They love that. I'm like, yes, ma'am.
Yes, ma'am.
Yes, we're going to do this. All right, you good? And then they say, ooh, honey, this is never comfortable. No, ma'am. But it's going to be all right.
We'll get through it together.
There it is.
Well, that was just a little snippet about what to expect when you go to the gynecologist. Again, make sure that you are with somebody that you're comfortable with. Your style and their style matches up. I think that's always really important. If you feel more comfortable talking to them first, before you have the exam done. I've had some people who come in just for a visit. They just want to talk, get to know you, get to know your style. And then come back for an exam.
Fine.
A couple of things to remember. It's best not to do this when you're on your period. Pap smears, STD testing is not, you can't read it if you're on your cycle.
Well, depending on the type of pap you do, if you're not on a heavy cycle, because I can do, depending on the type of pap, if it's a thin prep pap, if it's a light flow, call your doctor. Call ahead of time and just see. Tell them what's going on, and then they may or may not still be able to see you. But if it's heavy, you're right. No one's going to read it. You're not going to be able to read it.
Not
so
good
it's
for heavy.
There it is.
But otherwise, come in anytime you have any questions. We love chatting with you, and we will see you next time.
And this has been If These Lips Can Talk. Could talk? If These Lips Could Talk.
A bimanual exam is just feeling the ovaries, feeling the uterus, making sure that we have a little guest lecturer here with us today.
Yes, ma'am. Okay, if you're gonna sit, will you be quiet, like an inside voice girl?
Yes.
Thank you. Okay, so back to.
So we did the pelvic exam.